Alright. So today we'll start off with discussing what is TDM. Okay. So TDM is essentially therapeutic drug monitoring. This is a process that is required especially for drugs that have narrow therapeutic index. I will explain what are narrow therapeutic index drugs, but just imagine those drugs that need to be monitored very carefully because they can create dependence or they can create very huge problems in the patient if even if the dose varies a little bit or if there is some problem that occurs in the patient. What kind of drugs can be very harmful. So for those drugs, especially therapeutic drug monitoring is done. Now, essentially, what you're doing in therapeutic drug monitoring is you are monitoring the treatment. You measure the patient's plasma concentration. You measure the concentration of the drug in the plasma. So you measure the plasma concentration of the drug at different points of time after giving the drug. That is therapeutically monitoring the drug. So, for example, let's suppose you are giving some X drug and you know that this drug works for let's suppose 7 hours. ठीक है तो आप 0th hour पे दे रहे ड्रग what you do is 0th hour पे you measure what is the plasma level. Let's suppose the plasma level is 1, then or let's suppose the plasma level is 0 at 0th hour. At 0th hour plasma concentration is 0. ठीक है then by the first hour, first, second, third, fourth, फिफ्थ, सिक्स्थ एंड सेवेंथ फाइनली. ठीक है सेवेंथ आवर के बाद में ड्रग एलिमिनेट हो जा रहा फॉर एग्जाम्पल. ठीक है यू आर गोइंग टू द रेंज ऑफ सब थेरेपेटिक डोज अप्रूव. So for now, at 0th hour, the drug concentration is 0. By the first hour, let's suppose it is reaching about 30 mg per liter or 30 mg per dl. Okay. Then from 30 in the second hour, it is spiking a little bit. It is coming to 40. Then it is being maintained at 40. यहाँ पर भी 40 है. ठीक है यहाँ पर थोड़ा कम हो रहा. Let's suppose यहाँ पर 35 हो रहा. Here it is remaining 35 and here it is becoming 30. So essentially what you are doing is by monitoring the changes in the plasma concentration, plasma drug concentration, you will be able to predict what is happening in the patient. Okay? If the plasma concentration goes below or above normal, what will happen in the patient and what kind of steps you can immediately take to avoid such problems. That is one of the main purposes of performing therapeutic drug monitoring. Now, essentially, this plasma concentration itself will depend on several factors. It will depend on bioavailability, it will depend on volume of distribution, it will also depend on clearance. Clearance is a concept that has not been taught to you, it's not there for you, but essentially drug clearance is a part of drug elimination or drug excretion. Clearance में आप क्या करते हैं? You are seeing how the drug is getting eliminated. You calculate the clearance through different routes. So, for example, you calculate the clearance, how much of the drug is getting cleared out of the body through kidneys, for example, or through feces, or through any other route. So, उसके लंबे लंबे formulas रहते हैं. You don't need that for now. Just remember that it is one part of elimination. Now, how much amount of drug is being remained in a person's plasma and the body will strongly depend on these three factors. कितना what do you call कितना अंदर आया था, how much amount of drug entered systemic circulation, that will be bioavailability, how much amount of drug got distributed, volume of distribution, and how much amount of drug is getting eliminated per unit time. ठीक है slowly over the hours, how much amount of drug is slowly getting eliminated, that is clearance. Now, these parameters are variable. Among individuals, they can vary widely. That is why, for certain drugs, it is very important to do TDM. Now, what drugs carry? For example, you have low safety margin drugs like digoxin. Digoxin is a cardiac glycoside that is given to patients who are having heart failure essentially. या फिर आप थियोफिलिन दे रहे हैं या लिथियम दे रहे हैं. ये पूरे ड्रग्स जो है they have a very low safety margin, meaning at a very small dose they are safe. If you vary the dose even slightly, it might cause problems, huge problems. वैसे ड्रग्स के लिए या फिर you want to reduce the toxicity of drugs like aminoglycosides. Now aminoglycosides are famous to cause kidney damage. ठीक है? Aminoglycosides, right? So these are antibiotics that can cause kidney damage, quite significant kidney damage. तो आप क्या कर सकते हैं? Therapeutic drug monitoring करके you can give the minimum required dose, ठीक है? That can decrease the chances of kidney damage, but you are making sure that there is a minimum concentration that is maintained in plasma that will give you the desired effect. Now antibiotic है बोले तो it has to kill some bacteria. Now kill the bacteria or inhibit its growth. Now, in this sense, if you are giving a normal dose, we know that there might be some, detriment or some risk to your kidneys. So, आप क्या करते हैं? Minimum dose which can be given for safe usage, minimum dose that can be given for to achieve a therapeutic effect. वो देते हैं, and you are constantly monitoring the plasma levels. Let's suppose that plasma level is going below normal. That is when you can spike up the dose a little bit, but still you will be in the safe zone. तो वैसे चीजों के लिए या फिर for example you have drugs in which there are no reliable methods to assess the benefit. For example, antidepressants. Now antipsychotic drugs are antidepressant drugs. Now antipsychotics and antidepressants are not the same, but antidepressant drugs जो है or any drugs that will fall into the psychiatric category, they will take a while to show its effect. ठीक है? Generally speaking, they can take anywhere between 3 to 4 weeks or sometimes 8 weeks or 12 weeks, 2 to 3 months के बाद you'll start seeing the change in a person's behavior. Okay, it'll take time. So to find out whether that drug is working or not, you need to measure the plasma level, whether or not it is being achieved altogether or not, because behavioral change will take quite a lot of time. So even after, let's suppose, 2 months or 3 months, the person is not showing any change. तो अगर आप वो टाइम पे थेरेपेटिक ड्रग मॉनिटरिंग कर रहे थे, you will have known that okay, the drug is already present in the person's body. It is just that it is taking some time, and change will come. Okay, you as a doctor will already know. See, I've already done my part. I've given the drug. Even if you look at the plasma concentration, there is good concentration of the drug being maintained in the person's body, meaning the drug is having an effect. It is just that outward appearance takes time to change. वैसा, like a behavioral change takes time. So you can rest assured. Let's suppose you are performing TDM for those drugs and you are finding that because of a certain combination of drug or because of certain factors, that drug is not achieving minimum concentration in blood. That is when you can either increase the dose or you can switch to a different drug. Okay? So you will already know if the drug is not reaching enough plasma concentration in the blood of that patient, it will not show any effect. Meaning you will have to change the drug or you will have to increase the dose so as to expect any behavioral change down the line. ठीक है? आपको मंथ 1 में या लेट्स सपोज 3rd या 4th वीक में ही पता चल गया तो आप जब भी स्विच आउट कर ले सकते हैं ड्रग को, बिकॉज even if you give the drug for with or without the effect of the drug, you will have side effects. Okay, even if you have the effect behavioral change at the end of 3rd month, or you don't have any behavioral change at the end of 3rd month, there is a good chance that the patient will already be suffering from side effects. So just so that you can avoid unnecessary side effects, आप TDM कर रहे हैं, just to make sure that even if they are having side effects, they are getting the beneficial effect of the drug, or else it will be useless to give the drug. वैसा है. या फिर अगर आपके पॉइजनिंग है, कोई पॉइजनिंग पेशेंट आए टू ट्रीट पॉइजनिंग, इन दैट सिनेरियो थेरेपेटिक ड्रग मॉनिटरिंग बहुत हेल्पफुल रहता है, बिकॉज थ्रू टीडीएम यू कैन फाइंड आउट whether the concentration of poison in that person's blood is decreasing and concentration of antidote in the person's blood is increasing. ठीक है, वैसे चीजों के लिए. अब टीडीएम कहाँ पर काम नहीं आता? टीडीएम इज यूजलेस इन to measure responses of drugs that can be easily measured. For example, let's suppose you are trying to measure changes in BP using antihypertensive drugs. You don't need to perform TDM for those drugs. In most scenarios, don't need to perform TDM. Okay, don't need to keep on checking the patient's blood concentration of drug. As soon as you give a BP drug, within a few minutes or within a few, almost within 1 hour or 30 minutes to 1 hour, you will start seeing the effect of the antihypertensive. BP will start going down. Okay, very rarely it will not work. Or TDM is useless in drugs wherein they are called hit and run drugs. Hit and run drugs वो रहते हैं जिसमें you are giving the drug once, But even after the drug is getting eliminated, you are seeing the effect of the drug. Because the effect of the drug will persist for a very long time, even beyond the concentration that it is staying in your body. In the sense that, for example, I give some X drug. Okay, I know that drug works for 8 hours, or it stays in a person's body for 8 hours. It's the plasma concentration, therapeutic concentration is being maintained for 8 hours. इसका मतलब क्या है? मैं 0th hour को दे रहा हूँ. From 0th hour up to 8 hours, that drug is inside the body, and let's suppose within maybe 13 hours or 14 hours, the drug is completely getting eliminated out of the body. Okay? Meaning there is no metabolite, nothing is left of the drug. Now, the hit and run drugs kaise rehte hain, even if you give the drug intending for it to work during this period of time, because of certain phenomena, what will happen is its action will continue beyond this 8 hours, and it will even seep into those 14 hours. You'll see the effect of the drug for a longer period of time beyond its concentration. I'll give you an example. Let's suppose there is one strong antibiotic. There are certain antibiotics, जैसे colistin है या थोड़े antibiotics क्या करते हैं, they are very strong bactericidal, meaning they will kill bacteria at a very progressive, very aggressive rate as well. मतलब let's suppose okay, one concept that you need to know is a single bacteria cannot do anything in your body, and it has to divide. It has to multiply a lot for it to cause a proper infection and it to cause any symptoms in your body. You get to cause any problems altogether. Let's suppose when a person is going to a hospital and getting admitted, that person has about, let's suppose, 1 lakh units of bacterial colonies in their body. Okay? And they are going to a hospital and they are getting treated. At this point of time, what will happen is, let's suppose you are giving an antibiotic X. What this antibiotic can do is, now this is hit and run case, okay? This fellow will kill a lot of bacteria. Now let's suppose this bacteria's name is Pseudomonas. Okay? This is only an example, okay? And let us suppose that you need a minimum of 50,000 copies of bacteria to show any symptoms. You need at least 50,000 Pseudomonas present in your blood or present in your body for it to show any disease effect, for it to show any signs and symptoms and anything. Okay? Let's suppose that is a baseline. मतलब minimum 50,000 रहना for that patient to be ill. 50,000 से कम है बोला तो the patient will not be ill. They'll have bacteria in the body, but they'll not be ill. Now, a patient is coming to the hospital with 1 lakh bacteria, meaning double the minimum criteria. आप एक X antibiotic दे रहे हो उनको, ठीक है? When you prescribe the antibiotic, let's suppose what is happening is this X is going and killing a lot of these bacteria, and this number is coming down to 20,000. ठीक है? तो essentially आप क्या कर रहे हैं? You are decreasing the number of bacteria by 1/5. You also will see that suppose this drug is only working for 5 hours. X is working for 5 hours. Within 5 hours, it is able to kill so 80,000 bacteria. Example. ठीक है? यहाँ पर क्या होता? Even after giving the drug, let's suppose that the drug is working only for 5 hours. Essentially speaking, once I remove the dose, I should start seeing the symptoms and the effects of the disease again. But यहाँ पर the beneficial effect or the hit and run effect is that the minimum criteria or the minimum number of bacteria that are required to show any effect or required to cause any significant damage where the person is being, showing signs and symptoms that they are having high fever, example, or they are having rashes or whatever is happening in them, that is 50,000. यहाँ पर 20,000 कर दिया इसको. ये bacteria killed so many that it is now 20,000. Now it will take time for these 20,000 to go back up minimum to 50 to show any effects, then go back up beyond 50. So the time period जो है where that drug has worked essentially is not just 5 hours. It will also be counted, this 20,000 to 50,000, the time taken for this bacteria to reach from 20 to 50, that will also be counted under the effect of the antimicrobial drug. Meaning, let's suppose 20,000 से 50,000 होने के लिए that bacteria takes 3 hours. Example. So drug action is not for 5 hours. यहाँ पर drug action is for 8 hours. 5 plus 3. I will repeat that concept once again, just in case you did not understand. Let's suppose there is a person who is getting infected by a pseudomonas bacteria. Okay, and let us suppose that for a person to show any signs and symptoms, any clinical symptoms, you need at least 50,000 copies of that bacteria inside the body. Okay, minimum 50,000 bacteria रहना for that patient to be severely ill and to show any effects, clinical effects. अब यहाँ पर क्या हो रहा, patient is coming to the hospital with 1 lakh bacteria, double the minimum quantity. Now, a doctor is prescribing one antibiotic X, okay, and it is a hit and run antibiotic. Meaning, what will happen is this antibiotic, if it is a strong microbicidal agent, let us suppose that is working only for 5 hours. It is there inside the person's body only for 5 hours. Meaning, once you give the drug, it will stay in the plasma. It will maintain a therapeutic concentration in plasma for 5 hours, and after 5 hours, it will get eliminated. Okay? It will go into subtherapeutic range, and you will not see any effect of the drug. But यहाँ पर क्या हो रहा, this X जो antimicrobial drug है, it is killing, let's suppose 80,000 of these bacteria, ठीक है, and the number of bacteria is coming down to 20. Now you know that Pseudomonas needs at least 50,000 copies to show any signs and symptoms. And यहाँ पर फिर से signs and symptoms और clinical symptoms दिखने के लिए this 20,000 need to multiply up to 50,000. And let us suppose it takes three hours for that bacteria to divide as much. Meaning now in this hit and run case, कैसा रहता, that drug has not worked for 5 hours. It has essentially worked for 5 plus 3 hours because you are seeing the effect of the drug beyond the scope of that drug, beyond the time where it is there inside your body. It is there only inside your body for 5 hours, but you are seeing its effect beyond those 5 hours. That is on hit and run drug. वो cases में आप TDM नहीं करते, ठीक है, because you know that it is a hit and run drug. You already know that the drug's effect will persist beyond its concentration, beyond its plasma concentration, even after it is getting eliminated. वो drugs में भी आप TDM नहीं करते. So I hope you understood what are hit and run drugs. I hope you understood this example. So that is about TDM. Then we have another concept. These are small concepts that you have. There is therapeutic window. I'll explain therapeutic window using an image. Yeah, देखो. So therapeutic window is essentially the window or the how should I put it? The dose range which you can give safely to a patient. For example, if I chart plasma concentration and time over y-axis and x-axis, and I see the response of a drug, what is happening? अब यहाँ पर देखो, you are giving the drug here at 0th hour, ठीक है? Once you give the drug at 0th hour, slowly the concentration of the drug is increasing, and by the time it is reaching this point, okay, let's suppose this is different time intervals, okay, 1, 2, 3, 4, whatever it is, 5, 5th hour, 6th hour, let's suppose it is an hours, okay. By this logic, आपका plasma concentration of the drug is highest at the 2nd hour, okay, even though it is working up to 5th hour. Meaning, see, यहाँ पर almost at 5th hour के पास therapeutic concentration is still being maintained, 5 hours 15 minutes, let's suppose. Meaning that drug starts taking effect within, let's suppose, 45 minutes here, and it is working up to 5 hours 15 minutes. मतलब the drug almost works for 4.5 hours. ठीक है. Therapeutic window क्या रहता? ये duration of action हो गया आपका. 45 minutes पे effect दिखने लगा आपको, and that effect is lasting up to 5 hours 15 minutes. Example यहाँ पर based on what I have drawn. ठीक है. Therapeutic window is essentially the difference between minimum effective concentration and minimum toxic concentration. ठीक है. Minimum effective concentration जो है will be any concentration that is the minimum concentration that is required to show a proper clinical response. For that drug to show its effect, it needs to reach a minimum concentration that is beyond the subtherapeutic dose. उसको MEC बोलते हैं. ठीक है. यहाँ पर let's suppose for example मैं paracetamol ले लिया. Paracetamol का I know that dose that I give is around 325 mg. ठीक है. अब 325 mg में let us suppose MEC of the drug is 30 mg per dl. ठीक है. इसका मतलब क्या है? if the plasma concentration of that drug does not reach 30, it will not show any effect. It has to cross at least 30. It has to cross that threshold to show any effect, to see any desired response altogether. And let us suppose the toxic concentration is around 60. ठीक है, so 30 to 60 आपका थेरेपेटिक विंडो बन जाता. 60 के ऊपर गया, 60 mg per dl के ऊपर गया, तो टॉक्सिक कॉन्सेंट्रेशन में जाने लगता है, where you start seeing side effects. ठीक है, मीनिंग योर थेरेपेटिक विंडो विल बी 30 mg. यहाँ पर 30 mg से 60 mg के बीच में अगर ड्रग कॉन्सेंट्रेशन मेंटेन हुआ, दैट विल बी थेरेपेटिक विंडो. मीनिंग anywhere between 30 to 60, you can, that concentration can be maintained and the person will have antipyretic effect. Okay, their body temperature will be low. If it starts going beyond 60, you'll start seeing side effects. If it is going below 30, you will not see any effect. So that is the therapeutic window. Now, why is this important? There are some drugs called narrow therapeutic index drugs. Okay, अब यहाँ पर, for example, this will also help you determine what dose can be safe for the patient. For example, if I draw that same graph again, let us suppose I draw with respect to paracetamol itself. Okay, same plasma concentration versus time on X, and यहाँ पर time, यहाँ पर plasma concentration. ठीक है, and let us suppose this is the threshold, meaning इसके ऊपर जाना minimum, इसके नीचे गया तो सब therapeutic रहता है, you will not see any effect. And let's suppose this is the minimum toxic concentration या maximum effective concentration भी बोलते हैं. Okay, just so that you don't get confused between MEC, I'm telling that as MTC. It is also called maximum effective concentration or minimum toxic concentration. Okay, let's suppose this is MTC, this is MEC, minimum effective. Okay, now let us suppose a paracetamol के दो doses दे रहे हैं. ठीक है, imagine the first dose that you give is 500 mg, or instead of 500 mg you give, let's suppose the main drug itself you give half the tablet. Imagine you give 250 mg of the drug. ठीक है, अब कभी कभी छोटे बच्चों को दे रहे तो, या in certain cases you just split the tablet into and give it to a patient, especially if their body weight is low and things like that. And let's suppose that this dose, the concentration, the जो आपको ग्राफ आएगा ऐसा आएगा. ठीक है, so what is happening here? This drug is barely going above subtherapeutic dose. It is showing effect. ठीक है, this is the therapeutic window. ठीक है, this will be the duration of action. ये दोनों के बीच में आपको इफेक्ट दिखेगा. एंड ये जो है आपका मिनिमम डोज है, जो आप 250 mg पे भी दिए तो इतना तो भी इफेक्ट दिख रहा है आपको. इट इज वेरी स्मॉल बट यू आर सीइंग एन इफेक्ट. ठीक है, इट इज नॉट अंडर सब थेरेपेटिक. नाउ लेट्स सपोज आई गिव अ हायर डोज. ठीक है, सेम MTC MEC, but here instead of giving 250 mg, imagine I give 650 mg. Okay, or 750 mg. ठीक है, in a single instance. Imagine I'm giving 750 mg. अब यहाँ पर क्या होता, concentration spikes quite a lot, and see, duration of action is also higher, but it is also going towards the risky area. यहाँ पर you can clearly see the difference है. देखो यहाँ से and यहाँ से कितना difference है peak concentration. But this is still under, this one is still under safe zone. ठीक है, because you are not crossing the threshold of toxic concentration, you will not see toxic effects. So that is essentially a therapeutic window. ठीक है, your play area where you can vary the dose. In certain patients you'll have to give a higher dose, in certain patients you'll have to give a lower dose, depending on their body weight, depending on their PK/PD parameters. बहुत सारे effect रहते हैं, अलग अलग factors. But you will have certain drugs called narrow therapeutic index drugs. Narrow therapeutic index drugs जो रहते हैं ऐसे रहते हैं. So narrow therapeutic index drugs are essentially like this. अब उनका सब therapeutic range इधर है समझो. Meaning you need to minimum you need to cross this threshold to see any effect, and the toxic threshold will be here. इसका मतलब क्या है? You have a very small window, narrow window where you can change the dose. I'll give you an example of digoxin. Digoxin का normal dose जो है is around therapeutic dose, okay, is around 2 mg, and digoxin's toxic dose is around 3.5 to 4 mg. इसका मतलब क्या है? By chance, if you increase the dose of the drug even by 1.5 mg, it will go into toxic concentration. ठीक है? And subtherapeutic dose will be below 2 mg. मतलब आप 2 mg के नीचे चले गए बोले तो you will not see any effect. If you go beyond 3.5 mg, you'll start seeing toxic effect. These are called narrow therapeutic index drugs. ठीक है? I hope you are understanding what is therapeutic index and what are narrow therapeutic index drugs. Narrow therapeutic index drugs will not have a lot of play area. आपको डोज में चेंज करने का ज्यादा वेरिएंस नहीं रहता. फॉर एग्जांपल अगर आप पैरासिटामोल ले लिए, इट्स अ वेरी वाइड थेरेपेटिक इंडेक्स ड्रग, मीनिंग इवन इफ यू गिव 500 mg और लेट अस सपोज बाय द डे हम 500 mg 3 टाइम्स दे रहे तो 1500 mg दे सकते हैं आप दिन में. ठीक है? वन सिनारियो इफ यू आर गिविंग 500 mg टैबलेट 3 टाइम्स अ डे, और let's suppose you give 650 mg tablet 3 times a day, that is 1950 mg. इसका मतलब क्या है? योर प्ले एरिया इज 450 mg. यू कैन वेरी बाय 450 mg एंड स्टिल बी इन सेफ जोन. यहाँ पर देखो 2 mg थेरेपेटिक डोज है एंड 3.5 mg 4 mg is toxic dose, meaning your play area is about only 1 to 1.5 mg, not more than that. So that's a very narrow therapeutic window. For such drugs आपको TDM definitely करना पड़ता, because even if the plasma concentration varies slightly, it can create big problems. Okay? Because especially this is a cardiac glycoside that will affect heart failure. The drug essentially क्या करता है? It will let in more amount of calcium inside the heart, so that if a heart is undergoing failure where it is not pumping properly, it will force it to pump properly. Okay? It will force the cardiac muscles to pump. अभी क्या होता है अगर ये डोज टॉक्सिक में चले गया, then the force of contraction will increase very much, and cardiac tissue can tear. So that is why small variance, only a very small variance can create a big toxic effect in this scenario. So that is therapeutic index and therapeutic window. Therapeutic window भी बोलते हैं उसको, therapeutic index भी बोलते हैं. And those are narrow therapeutic index. The another example is lithium. Lithium is a drug that is given for anxiety. It is given for epilepsy. That is also a narrow therapeutic index. ठीक है? छोटा डोज रहता and very small play area altogether. ठीक है? Now, what should we do? We have mechanism of drug action. Let's start mechanism of drug action tomorrow. Okay? Because if we start now, I don't think we'll be able to complete.